Welcome back to Family Health Today. Next week is National Community Clinic Awareness Week. So, in honor of that, our cameras traveled to the community clinic at St. Francis House, where Family Health Today producer Josh Irwin had a chance to speak with the people who make this fantastic healthcare facility a success.
Community Clinic is a federally qualified health center. And as a health center, we are a medical home for low-income and uninsured neighbors in Northwest Arkansas. We can provide this service by offering a sliding fee discount for patients who are uninsured. We use a sliding fee discount by looking at the income level, household size, and patients can access our services without insurance.
We provide the full spectrum of family practice medicine here at the clinic. We see patients of all ages, and in particular, we see patients that are low income, no insurance, patients that normally don't have any place else to go, and we can offer them services here to treat their chronic and their acute health problems. I'm very proud of the care that we do here. We have some excellent providers, physicians and nurse practitioners, and they could work anywhere, but they've chosen to work here because we feel it's a mission that we do. We can pretty much offer any services that you would find at a regular private practice medical clinic.
We have a pediatric program, so you can do your well and sick child visits here. You can do all of your developmental checkups, we call them EPSTD, childhood vaccinations, immunizations, school physicals, or even physical therapy. We can refer you to a specialist if your child needs one.
Well, we have so many success stories and we are so fortunate to have them, but I would say that one of the things that keeps reoccurring is that there are so many mothers in Northwest Arkansas who were previously giving birth to babies without seeking prenatal care before they were giving birth. And with our Prenatal Pathways program, these women are able to come in, receive prenatal care, prenatal vitamins, and at the 28th week be referred out to a partner of ours. So when they give birth to their baby, they're giving birth to a healthy baby that is not with a low birth weight and not a burden to the family or in the community. And that is something that's so happy for us, because so many people, and then they're able to use our services as their child grows older. And what else more could you want, is to bring more healthy lives into the world.
We are not a free clinic. That separates us a little bit. As a community health center, we offer the sliding fee discount if you're uninsured. Now, service payment is not due on this day of service. We'll work out a payment plan with you if the cost is a little high, but generally the minimum payment is going to be $20, and that includes your lab. But we're also going to see if you're eligible for any state-assisted programs or any grant-assisted programs for your needs. So when you come through the doors, if your child is eligible for Our Kids First, we're going to enroll you right here on the spot so your child can go ahead and access services that day. If you're pregnant, we're going to enroll you in Medicaid right here on the spot so you don't have to leave and go to DHS or work through any forms. We have all the financial support systems we can offer our patients to make sure they have access to health care.
We have several outreach programs that we offer for the community here at Community Clinic. Those include a tobacco prevention program, a tobacco cessation program, an HIV outreach program, as well as a Komen breast care program. And we offer, like Cambry mentioned, we are able to sign up families for Our Kids First here at the clinic and around the community. One of the programs I really wanted to highlight was our tobacco cessation program. It's a low-cost cessation program. It's $25 or $5 per class. It lasts for 5 weeks, and that includes a patient's pharmacotherapy if they choose to take that, which includes Wellbutrin or Chantix. We also offer lozenges, the patch, whatever the patient chooses.
The community clinic currently has 2 dental locations, one in Springdale and one in Rogers. The Springdale location primarily focuses on children's care, and we see a lot of patients that are uninsured and have the Arkansas Our Kids or Medicaid. The Rogers clinic focuses on the children and the adults. We pretty much operate just like regular dental offices, doing pediatrics and general care. We take care of a lot of the patients that nobody else will see, or the patients that slip through the cracks. Sometimes they're uncomfortable going to other offices. They feel more welcomed and comfortable here. We have a lot of bilingual staff that can accommodate that population, so they just feel more at ease than they may in some other offices.
About 15 years ago, a group of faith-based individuals got together and decided they wanted to do good in the community. So they started providing food, shelter, and then they soon figured out what the real gap was medical care for those without insurance. So they started voluntary clinics and soon started writing grants to support the programs, but about 2004 they ran out of resources. And through the goodness, through the help of Bernice Jones, she offered them a spot here at the Jones Center for Nonprofits, and we opened up the community clinic. That first year we saw 1,500 patients, and while that may sound impressive, last year alone we saw 19,000. So through the gift of Bernice opening up the doors, we were able to get stable, have a place for the doctors, and then we became a federally qualified health center through supportive grants to the Bureau of Primary Health Care. We have about 90,000 uninsured residents in Northwest Arkansas. And when you're uninsured, that means you're going to delay seeking care, you're going to not seek preventive care, you're going to find that you're going to have less effective and more expensive treatment, which is going to roll right back into the community. Or patients are going to visit the emergency room for their medical care. And opening up the doors to everybody in the community, we believe everybody has the right to medical care, has been able to defer those people out of the emergency room, keep them out, keep people out of the hospitals, and help them lead healthier lives. Right now we have 5 sites. We have a medical clinic in Rogers, a medical clinic in Springdale, and a medical clinic in Siloam Springs, and 2 dental clinics, one in Rogers and one in Springdale. We have probably 6 to 7 MDs, a whole host of advanced nurse practitioners. We also have 40% of our staff are bilingual, from the front desk, people who answer the phone, to our medical translators, so there's no ambiguity between what the physician and the patient's hearing. So we have really molded ourselves to look like the community we serve so that we can be that medical home for folks, and they are comfortable in this environment. Our patient surveys show that 90% of our patients hear about our services from family and friends, so we know that the trust is there in the community. The quality of care is just as though you're going to see from any other primary care physician in Northwest Arkansas. State-of-the-art equipment, highly trained staff, all of them here to help, generally with a benevolent heart, to make sure that everyone gets equal access to care.
One of the neat things that we have coming up at Community Clinic is Community Health Center Week, and that's a national celebration for community health centers across the country. It's August 8th through 12th, and we're celebrating that event in our Benton County and our Washington County sites. 2 of the events that we're going to have are we're going to award champions in the community with Community Health Center Champion Awards, and we are very excited that people have seen our cause and they see what we do, and they fight within the legislature and across the country to receive more money for community health centers. One of the things that we're going to do for our patients is we're going to have patient giveaway bags stuffed with healthy fruit and different healthy living items, so they can see that we appreciate them as our patients, and we appreciate them coming through our doors, and we're honored to give them their care.
If people want to help us out, they can call our Human Resource Office, and we can get them engaged in volunteerism with the clinic, especially with our outreach programs and our patient education programs. We also obviously need the support of the community to keep our doors open and to help these patients get care that they need.
It has been an absolutely fulfilling experience to be a member of the staff at Community Clinic. Not only am I lucky enough to work with some of the best providers in Northwest Arkansas, but we have a fantastic staff. Furthermore, I get to work right by the dental clinic, and we have so many children that come through our doors, and to see their bright shining faces, even after they walk out of the dental clinic and are crying, I can tell that they are getting care that they would not be able to receive anywhere else, and I'm thrilled to be a part of that mission.
Stay tuned. Family Health Today will be right back.